Gurmagat Cahirlock, and to Mr. Gloucester and to all your team for being with us today. I suppose often at the Public Accounts Committee we concentrate on the procurement elements of your budget, but often the staffing element is the most significant level of spending. And I suppose in your line of business it's also the area that has the greatest impact in terms of service delivery. I'm not sure if you're familiar with the Montague report, which was Dublin City Council drafted regarding Ballymun, a brighter future, but it focused quite a bit on the issue of the impact of the drugs industry on the community of Ballymun, and it spoke about the engagement of Tulsa in that area. And it pointed out that the Dublin North City, which of course includes Cabra and Finglas and other areas, has the highest number of children in care in the country, and while it also has one of the highest allocations of staffing, it has a huge number of vacancies. And I wonder if you could talk to me about the issue of filling those vacancies, the cost of filling those vacancies, and why those vacancies are so persistently vacant, if you want to put it in those terms. And we might come back then when I hear a little bit more on that.
Sure, Deputy, and I'll maybe come back. I'll talk to you at the end of the answer on the global HR, but to be fair, you've asked a very specific question in relation to North Dublin, so I might ask Kate Duggan, the National Director of Services, just to address that for you first.
Good morning, Deputy. Yeah, we are very familiar with that report, and our area manager in Dublin North City, Joy McGlynn, certainly has been part of the interagency approach both to that report in terms of its finding and its recommendations. And as you rightly point out, Dublin North City is one of the areas that we are, significantly challenged in terms of the profile of children and families that require our support, and the profile of children and young people that touch off our system in terms of either family support or in terms of the care system. You've also pointed out that Dublin North City has the highest number of children in care, and Dublin North City also has the highest number of community and voluntary services within that region. So one of the areas that we look at and focus on in Dublin North City is how we work much more collaboratively and use and work in partnership with our community and voluntary partners to respond to the need that's there. But Dublin North City, like the rest of the country, is challenged in terms of our ability to allocate an adequate number of social workers. At the moment in the agency we have approximately 1,770 social workers in terms of the headcount, and at the moment we have a number of vacancies, and that is also compounded by a number of staff, approximately 70 staff who are on maternity leave. And in the context of COVID-19 across the country, those staff, because of health and safety reasons, are often working away from the front line from the beginning of their pregnancy. So we are challenged in terms of our allocation of social workers right across the country. We're taking a number of actions, and we've already spoken about the agency conversion programme that has happened. We are facilitating a number of student placements. Our CEO is engaging certainly with the Department of Higher Education in terms of looking at increasing the number of student placements. We offered a permanent contract to every new graduate that was qualifying from the universities this year, and so far out of 184 places in the universities, 130 individuals expressed an interest in coming to work from Tulsa, and that translated after qualifications and interview to securing 99 additional social workers. That is for the whole of the country, and 89 social workers left the agency from January to July this year. So we are significantly challenged in terms of our ability to allocate social workers in 2021 out of additional funding from the government of about €7 million. We did allocate 65 new social work posts across the country, but the challenge remains, and the solution is around looking at working with partner agencies and actually diversifying our workforce. Particularly, you talked about the likes of drug issues, substance abuse issues, and issues like domestic violence in Dublin North City, and we're looking to diverse our workforce to meet that response.
Yeah. I think certainly you've touched on 2 points, Kay, and the report. First of all, I'm delighted to hear that you're more than familiar with the report and participating in the interagency response. I know it's something that the Taoiseach's office is also an involvement in. Just on the two issues that you touch on, I suppose recruitment is one element, but retention is also another issue.
Yeah.
I know Dublin North City has a 4% of cases are allocated within the 40 days. The national average for Tulsa is 22%. So there's something else going on in Dublin North City, and it's obviously to do with the difficulty of the work for many social workers and the retention issue. And I suppose the report points out that perhaps the appointment of more senior social workers would be one way of responding to that, giving people more responsibility, obviously, but also perhaps keeping them in post for longer as well. And I wonder if that's something you've had an opportunity to consider.
Yeah. I think that's a very fair observation, Deputy. And there are a myriad of reasons as to why it's difficult to retain. We've invested a lot of energy this year in understanding fully the people who leave us with less than 2 years service with us and the people who leave us with less than 5 years service, because it's in that years band that the retention problem is. People who leave after 5 years tends to be probably for more understandable reasons. There are a couple of factors that I would say to you. Firstly, pre-COVID, Dublin, particularly Dublin, in the city, was difficult to attract social workers to come and stay. And there are some really, really good social workers in Dublin, and we're delighted that they are with us. But to attract new to come and stay, cost of living, lots of different reasons. That's one factor. The other factor is that there has been an increase by social work employers across the country in their demand for social workers. So this year, 184 people came off the courses in Ireland. 144 of them registered with Coro by September, which means 44 are probably thinking about travel or something like that. That's 144 available. I could use every one of those, and I did offer every one of those that wanted a job. But my colleagues in the health service are recruiting social workers, the probation service recruits social workers, the Section 38 agencies across the disability sector recruit social workers, and so on and so on and so on. Social work has now become part of the multidisciplinary team in every health and social care context. So that's a challenge for us. There is no doubt statutory child protection is considered to be one of the most hard-end areas of work to do. That's not to undervalue the work of anybody else, but it is considered to be one of the hardest areas of social work to do. And I've said many times, as I said in my opening statement, I think we have to move to a new model of multidisciplinary teams, because there are lots of other disciplines and professions who could
perhaps, Mr. Glasser, I'm just conscious I have 2 minutes. I think you're bringing me to the point I was going to actually follow on with Kay, was the idea of multidisciplinary teams, because there is recruitment issues. But I would come back to the issue of the senior social workers, and the report talks about 15 senior social workers in that area. And I don't expect you to give me a commitment here, but it might be something that you consider, because I will come back to you on it. But the issue of diversifying, and I would say two things. Youth workers, those involved in school completion programmes, those involved in the family support agencies and family support centres, are a huge asset, and I think should form part